As the Ministry of Health's vaccine rollout transitions from frontline health workers to persons aged 60 and over, a strategy has been implemented to accelerate jab distribution to this high-risk priority group. In addition to fixed mass distribution centres, the Ministry, acknowledging Guyana's unique social, economic and geographical makeup, has partnered with faith-based organisations and neighbourhood democratic councils across the country to mobilise senior citizens and bring the vaccines to them.
We are here in an NDC area. And so this is what we want everybody else to do. If all the NDCs come together and mobilize their people, if the mandirs and the mosques and the churches come together, and sometimes you don't have to work separately. In this case, everybody worked together in a community, right? And it was organized, so all we did is now to show up with the staff. I am told that we have finished over 100 people already, and it's not even lunchtime yet.
A council member of the Canal Polder Polder NDC described her experience in organizing the drive and working with the Health Ministry staff.
My name is Nirmala Ganesh, Councillor of Canal Polder NDC. We are very grateful to have the Ministry of Health here with us to share the COVID-19 vaccine. We've started to arrange this yesterday with the help of other councillors to get things in order. This morning we did the registration. We had 148 persons so far to do it. The process was very nice. The doctors and the nurses that came were very helpful to us. The helpers that we have cooperate very well. We are encouraging other NDCs and community leaders to do the same to help the elderly in their community.
Persons who came out to receive their first dose of the COVID-19 jab also shared their experience.
Iris Passad,
And why did you come today?
to get this COVID injection.
Were you scared at all?
No,
No? So why did you come to get it?
to prevent any sickness.
I encourage them to come here, to come and take the vaccine. It's very good. Not feeling bad.
Well, I took the vaccine. Personally, I took the vaccine because I want to protect myself against the COVID-19 disease, and so that's primarily why I took it. Because we fear, about the death increasing and so on in the country, and if this is one way, we can curb that rise in the amount of people being infected and dying out.
Dr. Ramsamy shared that many lessons were learned from the pilot Burns Memorial Vaccination Initiative, with more people coming out than anticipated.
We definitely learned from Burns Memorial. And so yesterday I was here with the local organizers, which is made up of the NDC councillors and community people who live here. And so we were able to set up the flow so that there is no confusion. We have been able to use local resources because there are many people here who are going to university, who are teachers, who work in the public service, who are at home. And so we have utilized them. And so you see between our staff and the local volunteers, there is an adequate number of staff to move people. It's barely lunchtime right now, and we have already finished 120 people. And therefore, by 3 o'clock, we should finish over 200 people here. We were catering between the two sites here and Bell West to do 300 people. I believe we will exceed that number, and so it has demonstrated to be a model that works, but more importantly that the people and the technical staff seem to really like.
Guyana is currently administering the Oxford AstraZeneca vaccine, which the EU's medicine regulator has concluded is safe and effective. The Sinopharm vaccine is also being administered in Guyana, with Russia's Sputnik V COVID-19 vaccine expected later this month. I am Danielle Swain, reporting for the newsroom.